And you know, can you develop a process? I'm kind of obsessed with the idea of process, and I steal that word liberally from a much more talented, much smarter behavior analyst than I, Greg Hanley, who talks about process a lot with practical functional assessment. So I'm going to talk about some cases today. I'm going to show you some research that we've done about a severe novel problem behavior. And again, please, at any point in time, if you have a question, please put it in the chat, okay? So here's the crux of my presentation, really, is these are the 5 questions I want you to ask when you deal with a problem behavior. And I think it's wise to, again, kind of, until this becomes habitual, until this becomes routine, if severe problem behavior is outside your scope, I would suggest you almost verbatim write it down and do it as you continue to develop your own skill sets. The first thing you have to ask is the behavior issue of safety. We're going to break down what safety threats are here in just a minute. But sometimes what people regard as an unsafe behavior may not be unsafe, and then sometimes what people don't regard as people regard as safe is actually unsafe. The best example I could give you right offhand, we were working with a child who was adopted from a Romanian orphanage, and he used to dig into his temple all the time and go like this. And while that appears fairly innocuous, he did it so often and so much that he eventually dug his skin out in and around his eyes and his temples. It's very severe self-injurious behavior, but it was not loud, it was not demonstrative, so it didn't draw people's attention to it. Okay, and I must always be aware that just because the behavior isn't noisy doesn't mean, of course, it's not dangerous. Secondly, and something I came from psychology. I'm real happy that I came from psychology. I revere psychology and education. I had nothing but good things to say about psychology and education because most of my family are teachers. One of the things they teach you when you're going through grad school in psychology is consult, consult, consult. And when I asked some recent students of mine, have you heard the idea of consultation? They said, yes, we covered in blank class in our master's program in behavior analysis. In psychology, they say it to you almost every single class. You know, we need these networks of people who understand certain phenomenon so we can reach out to them when we do have questions. Now, there obviously is consultation that doesn't mean person to person, and that's we'll get to number 5 here later, is consultation of research and research literature, which is extremely important. My other big message to all of you all who are practitioners, because I am a practitioner, is we move away from the literature, which is just insane to me. We develop habits, and then those habits persist even when new assessments and interventions are developed. So we'll get there in a minute. Third, the most obvious piece is what are the conditions under which the behavior occurs? I think it's important to understand that because when it comes to severe and complex behavior, we do have a methodology, a very good methodology for how to assess it and how to look at function, whether it's through descriptive means or through experimental means to understand what's driving problem behavior. The problem that we'll present and talk about today is sometimes it's difficult, if not impossible, to replicate stimulus conditions. And then when that's the case, what do? Do you throw up your hands and say, well, no research literature and I can't recreate this situation, or do you think outside the box? I'm going to encourage all of us to keep thinking outside the box. Next is what skill deficiencies contribute to problem behavior or to the safety problem itself. One of the things I admire about the people who are into early intervention is how they continue to rub off on me in my practice about the importance of teaching. And I think without that teaching component, I think the teaching component of behavior analysis, and that we are, again, not only ideally doing it, but ethically having to do it if we're using a punishment procedure for some problem, is we have to teach and reinforce an alternative problem behavior. So there's got to be skill deficiency or so maybe it's an issue of won't do. More often it's probably an issue of can't do, but we need to teach skills. And then lastly, again, what does the literature say? The reason I keep saying this is we're going to talk about some cases where literature tells us what to do. And then we're going to talk about cases about what literature tells us not to do. Not included in our presentation tonight is this idea of evidence-based. Evidence-based is thrown at us all the time, okay? And I'll just ask a question in the chat. What constitutes an evidence base? Give me a few answers. What constitutes an evidence base? Beautiful, beautiful, yeah, great job, you guys, wonderful, wonderful. Replication. of previous work that someone else has done before, solid research, defined and replicable, peer-reviewed, you're correct. Proof. Oh, I don't know who iPhone is, but they said proven history that it works even if it's just your own. Absolutely. And that's the thing I'm super stoked about Katie's and your guys' responses. Absolutely. Evidence-based does mean we should look for peer-reviewed research literature, but you have to have data and evidence that whatever you've reviewed, researched, whatever you're trying is affecting your client in an appreciable fashion. Because if it's not, then why are we doing it? So again, sometimes there is no research evidence base, and what do? Do you throw your hands up? I argue most of us are practitioners, probably roll up our sleeves and decide to get busy, okay? All right, so severe behavior, of course, is a safety concern. And I think the behaviors that, again, most of us are familiar with are aggressive and self-injurious behaviors. That is, behavior that poses imminent threat to self or others. And I think we need to be conscientious about what imminent threat means, because I think sometimes if you watch some of the really cool, there's a great series of behavior analytic presentations from Western Michigan autism series. If you listen to Dr. Iwata talk, and you have him talk about a guy who gouged his eyes out. I'll be frank with you guys, I have seen the bulk of behavior in which a human being can engage in. Go Knowles. But in any event, I have not seen someone gouge their eyes out. I think we think if that's not happening, it may not pose imminent threat. I worked with a little boy before I became a behavior analyst who tapped his hand repetitively, okay? This was not a behavior analytics center. It was an autism center and group home situation back when I was in graduate school. And he did it so much that he lost the use of his right hand and moved on to his left one. That appears fairly harmless, but in the long term, it's extremely damaging. Lots of discussion too about even minor hand-to-head self-injury that isn't, overtly rough or hard or what have you, can do long-term damage. So we can be conscientious about that. And then secondly, the cases that, again, most of us don't feel as comfortable tackling are those that may involve law enforcement. Those are, again, what I call low probability events. There are things that the stimulus conditions don't happen often enough to make them easy for replication, and or their acuity, intensity. The fact of the matter is that it violates the law may be such that a single instance can have extremely long-lasting negative ramifications for that person and that person's community. So again, behavior that can involve law enforcement. We don't have a great definition of safety within behavior analysis. And so one of the things we're always supposed to do is collaborate with other people. Well, it makes sense to look at what other people say. And of course, the National Association for School Psychologists has a long history of saying really nice things about behavior analysts, number one, and functional assessment, what have you. But they also have this nice idea about what different types of threats. Transient threats are not safety threats as we would think about them. They present temporary feelings of anger. They can be jokes. They tend to be easily resolved, and they can end with an apology or retraction or a clarification. I don't think any of us want to go through them. I think most of us have been through it and what have you, but they don't, again, have the long-term serious implications of what the National Association for School Psychologists calls substantive threats. These are specific and plausible details such as a specific victim, time, place, and method. They're repeated over time or conveyed to different individuals. It involves planning, substantial thought, and preparatory steps, and it involves recruitment or involvement of accomplices. Furthermore, a substantive threat can involve an invitation for an audience to observe a threat being carried out, physical evidence of intent to carry out the threat, list drawings, etc. And substantive threats can be serious assault or very serious. And again, you see kill, rape, inflict self-injury, or involves the use of weapons. Okay. One of the reasons I bring this out too is because I think it's constantly it's very important for us to always realize that we talk about self-injury. I like talking about self-injury. I like helping people with self-injury. But self-injury, if you were to look at it for a balding 20-year-old male, as I was years and years ago, who was doing cutting or what have you, you'd never find it under self-injury. You'd have to look under psychological or counseling journals under DSH, deliberate self-harm. So again, part of what's borrowing from them, their ideas, is so we can always have a good conversation when we talk with one another. If I'm talking to a school psychologist about someone who's engaged in self-harm, I could say, this is what your organization calls a substantive threat. All right, so I came up with a little definition for what a safety concern is and what safety is, I think, from a behavior analytic perspective. Safety concern is a set of stimulus conditions, actions, or results of actions that results or potential results in physical harm, loss of property, and adversely impacts the immediate environment. Safety itself refers to the removal of or protection from a safety concern or less desirable outcomes. And lastly, safety can also refer to the control of recognized hazards in order to achieve an acceptable level of risk. If I have a heart condition, my doctor may recommend exercise to me. Because I have a heart condition, I don't. But if I have a heart condition, I'm asked to exercise. There's some risk, obviously, in exercise that you engage in, but the long-term benefit is there as well. So again, there's this idea, I think, that we understand we're going to work with individuals who have problem behavior. Again, getting back to it, I understand that is not everyone's cup of tea. At the same time, I saw in the last 4 or 5 years, both in my current position and my former position, that the default throwback when anybody got a case that was a little bit outside their wheelhouse was, it's not in my area of competency. I wanted them to think that we're a behavior analyst, and behavior analysts should be able to define a behavior, again, use the tools of assessment to begin understanding and collecting data, and at least starting the idea of how we can help that person. All right, so let's answer this, and you can put it in your own. You don't need to put it on the chat. You can answer it to yourself, but let's just do a little active student responding. Safety concerns can best be broadly thought of as what? A, actions, B, threats, C, stimulus conditions, or D, all of the above. I'll give you 15 seconds. And everyone is publicly posting their answer, meaning you're reasonably confident in your answer. And that's a good thing because everybody here is right. Do as kindergarten teachers say, kiss your brains. Safety concerns can best be probably thought of as all of the above, right? All right, here's the key. I think our professional ethical compliance code is excellent. I've been a behavior analyst as long as there's been a board, and I've been a behavior analyst as long as we've had a code, and I've watched its different iterations, and it's a very, very solid code. Many of the ideas shared with other professions as well, but our code does not comprehensively address safety, even though the safety of our clients and the safety of us as practitioners is often concerned, right? 2.09 treatment intervention efficacy in our ethical code does talk about safety. It gives some reference to it. It says in those instances where more than one scientifically supported treatment has been established, additional factors may be considered in selecting interventions, including but not limited to efficiency and cost effectiveness, risks and side effects of the interventions, client preference and practitioner experience and training. 9.02, characteristics of responsible research. In research, behavior analysts conduct research competently and with due concern for the dignity, something we don't talk enough about, but we should, the dignity and welfare of the participants. Behavior analysts conducting research take necessary steps to maximize benefit and minimize risk to their clients, supervisees, research participants, students, and others with whom they work. With respect to interrupting or discontinuing services, our code says discontinuation only occurs after efforts to transition have been made. Behavior analysts discontinue a professional relationship in a timely manner when the client is being harmed by continued service. It's a bitter cup of tea to drink sometimes, right? That sometimes people don't benefit from us. I am not everyone's cup of tea. I always tell the story that there was a boy I worked with, an assessment on a boy in the autism spectrum who's being aggressive towards 2 peers, punching them in the face. And I was working with him, and we did a DRI program initially where we first taught and reinforced him when he walked by the boys for putting his hands in his pockets, because you can't punch me if your hands are in your pockets, okay? We also did some, again, visual cues where he put some tape around his desk and made them adhere to giving him personal space around his desk and what have you. The program worked beautifully. Every time I would come in, he would attack those boys. To this day, I cannot tell you why, okay? My presence evoked aggressive behavior. Again, the teacher asked me to stop coming. I stopped coming. Voila, no more aggressive behavior. All right, I just ruined any credibility I have with all of you. Okay, you guys, while the code doesn't address safety very well, I think all of us are probably sometimes concerned about the use of punishment. I would encourage any of you guys who feel you're anti-punishment to examine your feelings closely, because punishment exists in the real world. Even if it's not socially mediated, there are, of course, naturally occurring contingencies of punishment. I think the great thing about our code is it actually addresses the safety threats from punishment very well. 4.08 says behavior analysts recommend reinforcement rather than punishment, but it says whenever possible. It is not always possible to go sheerly to simply run a program based towards acquisition. It isn't. And again, if any of you don't think I'm correct, you're allowed to think that way, but I encourage you then to read Dorothy Lerman's massive article on punishment from the mid-2000s. It's eye-opening. Will give you some good food for thought, okay? If punishment procedures are unnecessary, behavior analysts always include reinforcement. Always include, not sometimes include, always include. If you are putting in a punishment procedure, no matter how safe the punishment procedure is, no matter whether the punishment procedure is a brief reprimand, whatever it is, you always should include reinforcement procedures for alternative behavior in the behavior change program. Always. Before implementing punishment-based procedures, behavior analysts ensure that appropriate steps have been taken to implement reinforcement-based procedures unless the severity or dangerousness of the behavior necessitates immediate use of aversive procedures. There are times when there is a time for the use of emergency aversive procedures, okay? If Kristen is a 10-year-old young lady in a classroom running across the street, across a major thoroughfare, and I yell, "Stop, please stop," and begins running, and I see a car going to hit Kristen, thank God for Good Samaritan laws and our ethical code, I can tackle Kristen. The intent, of course, is not to harm Kristen, and Kristen will be harmed from being tackled. It's the idea, of course, that I would attempt to stop her from more serious harm, right? Behavior analysts ensure that the aversive procedures are accompanied by an increased level of training, supervision, and oversight. Behavior analysts must evaluate the effectiveness of aversive procedures in a timely manner and modify the behavior change program if it is ineffective. Behavior analysts always include a plan to discontinue the use of aversive procedures when no longer needed. Okay. All right, let me go to some of your comments before we talk about this. It's important to know what the situations like this happen. Absolutely. Kristen talked about the kind of necessary post-punishment analysis we all should do. One of the best people to talk to about that is Merrill Winston, who's a good friend of many of us on here. Some of you know him from his presentations. He's the most popular presenter every year at the Florida Association for Behavior Analysis Conference. He's a brilliant guy and really interesting guy with great perspectives. He's brilliant to talk to about the post-intervention analysis. Okay. He also sometimes talks about risk-benefit analysis. Right? And a risk-benefit analysis is a deliberate evaluation of the potential risks and benefits associated with a given intervention. A risk-benefit analysis should include with a course of action associated with greater benefits than risks. We should do no harm or do less harm and more good, right? All right, Katie says it's important to share unsuccessful experiences. Totally agree. Coming from residential where we did use physical restraint, I've seen successful application. I also saw my wife, who was a young behavior analyst at the time, come to our evaluations, to our treatment center, and we had a young lady, a very, very difficult client, one of the most difficult clients in the history of the state of Florida, according to other behavior analysts, and who fecal smeared and engaged in self-injury, and she would engage in self-injury, and my wife begged the BCBA at the time, please don't put her in a helmet. She is so ritualistic. She is so reinforced by routine that she'll do everything and anything to gain that helmet. Before the helmet ever got on, they put a helmet on, and they took it off one day, and she busted open her forehead, and they had a helmet on her for years. She was actually less risk for self-injury without the helmet. So you guys get the idea. All right. So methods to deal with safety threats. I think the best thing about being a behavior analyst is even though we're all going to come across behaviors that make us uncomfortable, behaviors that maybe we have not seen before, we have methods to deal with safety threats. Aside from the consultation of others and literature base, we have behavioral skills training. Behavioral skills training we'll get into in detail tonight. Behavioral skills training is the 4-step method of instructing, modeling, having the individual rehearse a skill and giving them feedback based on the rehearsal. There's a 5th step we'll talk about tonight as well. Behavioral skills training has an incredible evidence base in teaching safety skills to children, individuals with cognitive disabilities, individuals diagnosed with developmental disabilities, and typical individuals with no diagnoses whatsoever, okay? So behavioral skills training should be kind of a fallback procedure. It's something that should be in the back of your pocket that you don't ever just read about, that you're ready to pull out at any point in time, because it is one of the most effective teaching methods we have. And it's one of the most effective teaching methods we have to teach safety skills. Number two, of course, is functional assessment and functional analysis. I don't think any of you in here need to necessarily be fluent in functional analysis. In fact, it's coming from a practitioner background. Most of my friends who do behavior intervention plans are basing them off of descriptive means and a kind of comprehensive functional assessment, as opposed to the manipulations promoted by guys like Dr. Iwata and Dr. Hanley, etc. Okay? That being said, I hope we're embracing the idea that if we don't have a workable functional hypothesis, we're going to dare to experiment. The worst thing, I'm going to go off on a soapbox for just a second. The worst thing in behavior analysis we have ever done is looked at everybody in here when we looked to our supervisors. This was very prominent in the early 2000s. Just to let you guys know that I had a student tell me one time, I can't do a functional analysis unless I'm highly qualified. And I said, well, how do you write behavior plans for the people you work with who have severe behavior? They said, well, we base it off our descriptive assessment. I said, so your supervisor is more comfortable with you making an educated guess than trying to do an experiment? I can't believe that somewhere along the line we decided that guess is better than experiment. Look, I'm a practitioner. I'm what most of you guys are. I've written the bulk of behavior plans based off of descriptive means. But if you don't have the answers you have to, you've got to consider that. You've got to find some way to test. And again, there are different ways to test. We're not just talking about the traditional Iwata method. There are many ways to test. We'll talk about some tonight. And then, of course, one of the things we've got to come up with in the idea is that we don't have the answer to every problem behavior that comes our way. So we've got to do our best to attempt to prevent it. We need to think about ways we can put skills into someone's repertoire that when we're done working with them or continue to work with them, we have an idea that at least in certain situations, they know what to do. They demonstrated before with us. They have received reinforcement for engaging in a necessary skill. Okay? Questions or comments so far? All right. Well, while you guys are thinking, Jenna says, I declined to only just when I came to the session. That was interesting to navigate. That would be a bit unsettling, but that's great. Yes, critically about climate forward protocols. Kristen and team, one of my big concerns coming from the university is the university has tons of protocols. But then in the absence of protocols, sometimes my students have said, I said, well, what do you do in this case? And they said, well, what's the protocol? I don't know there always is a protocol, so I'm with you about that. When it's school supervision and functional analysis, we're definitely more reserved for research and mainly talk about not being practical safe. Definitely see more of a shift in the last few years. I'm glad to hear that about the functional analysis, because it was never meant to be privy to only those of us who receive some type of certification. That being said, I do think we need to understand, and again, my friend Andrew Buchanan here has done some research, he and his colleagues, and for example, functional analyses, if I'm summarizing some of the research he and his colleagues have done, does not always work well with seniors, for example, with dementia, if I'm not mistaken. So, and he's saying I did remember that from his talk. All right. Yeah, Andrew said we have to run an FA, not a traditional analog, but we need to account for our procedures based on function. That's, yeah. Andrew, you said that eloquently. We have to understand our process. And I think understanding your process, you guys, I've done a lot of eyewitness work. And I was the county's expert witness in cases. And one of the things you'll find out is you have to be able to articulate in court. You have to be able to do what they call articulate your methodology. It doesn't mean you have to win. It doesn't mean you have to know everything. It doesn't mean you have to defend what you did, that it's worse or better than mine. It means you have to be able to articulate what it is you did and understand why you did it. Okay. Jenna, I'm stoked that, yeah, some public schools do not like FAs, but part of it is the problem is that's the term we're using. I go in and tell them I'm doing an analog assessment. They will never know anything different. And I don't think we should be liars necessarily, but functional analysis is a bastardized term anyway. Some people, of course, think it means functional assessment, right? And what happens? Some people don't want it to be done because it's an experimental methodology. So they imagine you're an experimenter, you're coming with a white lab coat and a needle, and you're sticking Terry Loafman with a needle, and all of a sudden, now you know what the functional behavior is. Of course, it's not that. All right. You guys, this is one of the questions you're going to have to answer to prove that you were here today. Where was I born? I was born in Huntington, West Virginia. My parents moved to Florida when I was a very young child, but that's actually where I went to graduate school as well in Marshall. So anyway, I was born in Huntington, West Virginia. You need to know that. All right. All right. Not Huntington Beach, California. West by God, Mountain Mama, take me home, country roads. Aaron, West Virginia. All right. All right, you guys. So let's first talk about a case that probably seems similar to what you guys have dealt with before. We have a very large young man diagnosed with autism. Again, who's about as big as I am, and I'm a little bit less weight than I am, but I'm up 5'10", about 215. Okay, so, and this is a 6th grade elementary school student. And his teaching assistant, his one-on-one, was about 5'2" and about $130. Okay, he had no history of aggressive behavior, no history of aggressive behavior, and he started pushing her one day. Okay, and so being very large, when we said, why did he push you? We started doing our assessment because they brought us in very quickly. She said, well, he's trying to get my phone or a tablet, or what have you. Not only was he pushing her and pushing the teacher, he was actually pushing people in the commons area of the school. It was a very, very large elementary school, about 1,300 students. And he would push people in the middle of the commons area, this big, beautiful commons area with a sand sculpture. He would push and take parents' phones, kids' phones. I mean, it was kind of out of control for a little bit. So they called and said, oh, we need to get you here, we need to get you here, what happened? So, of course, you hear aggressive behavior, whatever, you go running and you find out what's going on. He would not stop pushing, okay? Per the 5 questions I gave you, I'd say, is the behavior an issue of safety? Not really. Pushing is unsettling. A large young man pushing on smaller people appears to be dangerous. He had done no bodily injury to anyone. He had sure annoyed a lot of people, okay? Potentially did some damage to property, but he did not, this was not a safety issue as we've described safety issues. Does it require additional consultation? I would argue that the bulk of people who are attending this today probably wouldn't be consulting too many people for a young man in the autism spectrum who's engaging in pushing, okay? So more often than not, we probably then look to say, okay, what are the conditions under which the behavior occurs, all right? And so we, of course, wanted to look at the sequence. I love ABC data recording. I love looking at the 4-term contingency and how things happen. I think it helps us really understand behavior, right? So there's the motivating operation, the thing that makes the reinforcer more or less valuable. There's the antecedent, what immediately precedes the behavior. There's the behavior itself, and then there's the consequence. So he was deprived of a cell phone or tablet. So what happened was, one day at school, the assistant was, when it started, she was on her phone. And he reached to get it. By the way, phones and tablets were often used by his family and the school itself as a reinforcer. And so when she had her phone in his ear, he reached for it, and she pulled it away. And when she pulled it away, he started grabbing it. So what they then did, okay, when he was deprived of it, in the presence of the teacher or the assistant, he would grab and push the teacher assistant in an attempt to get it, and he would be denied access. They even started locking him up, which didn't stop this pushing. They would come in the classroom, take the pads, take the tablets, take the phones, and put them in a locked closet. And he would push you over and push and push and push to try to get to him. So when we did this, there was no need. You guys, part of the talk today is, when do you do a functional analysis? Probably when there's a need to do a functional analysis. There's not a need to do a functional analysis here. What's happening? We've got an established operation for positive reinforcement, right? We take away the phone, which increases the value of the phone. It then also has the behavior altering effect of increasing any behavior that could produce the phone, which would include pushing and grabbing, right? So we said to him, we've got an easy plan. Here's what we're going to do. We're making that the forbidden fruit, okay? And we did, by the way, we did not go into the school and go, this is absolutely not a safety concern. You're wasting my time. We don't win flies with vinegar, right? We've got to win them with honey. And so we said, it's pretty serious behavior, okay? Even though in our minds, it's not. It's pretty serious behavior. Tell you what, let's do this. Let's keep the phones and tablets out, redirect him, and he should be fine. And of course, the response to me was, that's easy for you to say, you look like a cop, okay? You're 5'10", you're 200 pounds, you're a big guy. Oh, okay. So I said, I tell you what, how about we have my 53-year-old behavior technician run the plan? She's about 5'3", about $130, okay? She's got brown hair like your assistant. She's tiny, but why don't we let her try the plan and run it? They said, that sounds like a go, okay? So we decided to do a structural assessment. If you remember back to your classes, the great thing about a structural assessment is it's not a functional analysis because it doesn't involve manipulating a consequence. It involves manipulating an antecedent only. And so we decided to hide the devices. So we had my assistant sit with him in this classroom for a 10-minute period of time, and we hid the devices. He pushed on her 13 times to get to the devices, okay? And they saw it, they watched it, we counted it. We said, watch this. Like, yeah, see how difficult he's being really aggressive. He said, you're right, he is. Now let's run the plan and see how it works. And so we had her take her phone out. She went like this. When he reached for it, she said, you can't have your phone now. You'll earn it when you're done doing your work. And she put it right down and said, okay, let's start working. The phone's down right next to him. And that was the only time he ever pushed, okay? We quickly won them over with a very brief structural assessment, a structural analysis. Do I think these things work every time? No. Do I think this kind of example evidences data that can be used to make a very powerful discussion to a team that's scared and does not know what to do when the behavior they think is unsafe, right? But this is relevant data. They loved it. They saw there were two women in the classroom who were smaller than I was. They saw a woman smaller than I was run the program successfully. They saw she didn't have to be scared. They took all the phones out, all the tablets out, by the way. Within less than 5 days, he wasn't grabbing tablets anymore. Okay? Surprise, surprise. Now, I tell you that story, share that with you because, again, this is not the most severe behavior. But again, I have a lot of students and friends who work at early intervention, and some of their centers don't take kids with problem behavior. If they came in pushing and grabbing, they may not take them at their center. I think there's always a way we can help. And again, I think just because emphasis is one thing in our practice doesn't mean we don't have the tools available to be able to address problem behavior. Okay. Questions, comments, concerns? Check the time. Doing okay. All right. Let's talk about more novel, dangerous, severe, complex behavior. Okay. And first, I'll tell you a story about May 2008 in Palm Bay, Florida. A school called Columbia Elementary School. There was fires. It was very dry that year, and there were many fires. Wildfires created by lightning, but also fires created by arson. And a fire created by a lighter, by arson, fire surrounded Columbia Elementary School. There were about 900 people at Columbia Elementary School before they could get 140 people out of the school. Fire surrounded the entire school. It came within 40 feet of the buildings. They could not get fire trucks in. They could not get the children and teachers and administrators out. By the grace of God, once it got within that 40 feet, they were able to get a fire truck in and get everybody evacuated. But it was a potential disaster of colossal proportions from a simple action. It takes nothing for serious fighters to start, right? From Huntington, West Virginia, where I was born, Huntington, West Virginia, where I went to graduate school. John Heisel reported he left his lighter unattended for mere moments. It's all it took for curiosity to get the best of his 5-year-old stepson, who Heisel said picked up the lighter and started a fire, all in the time it took his stepfather to use the bathroom. Children playing with lighters is too common a problem. I think adults need to be careful about when they leave their smoking materials. And they have young children, he said. It takes just a second, said Alan Adkins of the Huntington Fire Department. It can happen very, very quickly. Okay? I'm going to go back to fire setting in just a minute. People learn by doing, all right? You don't believe me? Look at my 2 children. This is Cooper here on the left and Preston here on the right. Question number 2 is, what sport do Andrew's children play? You should know the answer now is baseball. We spend a lot of time at the baseball field. But let me make an analogy that I like to make to people, okay? Nope, they play baseball and they swim competitively. All right, so you guys, Preston and Cooper, they're pictured playing game. By the way, these pictures were taken by my wife, Raina. She's a great photographer. So anyway, Preston and Cooper playing a game. If you think about the clients we work with, the children, the adults we serve, life is the game. So whether it's we're putting them in school, in a workshop, in the community, and what have you, they have to perform. But you never expect them to get to this point where they're in a game playing proficiently, right? Unless they practiced, right? And the problem a lot of times with severe complex problem behavior is not only does it present a huge challenge in our analysis of it, but sometimes, again, the stimulus conditions or the setting, the behavior is such that it makes it almost impossible to practice the necessary behaviors that can keep that child safe. A really good common example is children who have problems on the bus. Why do so many behavior analysts who work for school systems get to deal with bus behavior? Because there's only 2 times a day you can get on that school bus sometimes. And sometimes the bus drops kids off, leaves, goes back to the bus depot. You have to make special arrangements if you have a student who has any aversion to buses for whatever reason, to practice getting on the bus, putting on seatbelt, whatever the case is. It is a big, big challenge sometimes to replicate stimulus conditions, and we don't get, our the children and adults we serve do not get enough practice. That's why we need to learn more about behavioral skills training. We need to master behavioral skills training as a default procedure that we can pull out when we're talking about more severe complex behavior. Behavioral skills training is an adaptive learning procedure. It is acquisition-based. It is sometimes called coaching, and it's helpful to address low probability events. Low probability events are things like natural disasters, a person having a heart attack, a person drowning. Lifeguards and all of us who have taken CPR and first responders don't practice because those things happen every day. It's because when those things do happen, you have to be prepared to react under very adverse stimulus conditions, right? And behavioral skills training helps you get there to be able to teach skills that people can use when they encounter low probability stimuli, okay? All right, let's answer this, my friends. Since BST is acquisition based, one would hope for the data to show blank on a graphic display. Alice, my children did play basketball, and my younger one does sometimes play basketball like their father, but my wife was the softball player, and they've taken after her. And they're both very good at it, so that's cool too. All right. Whoops. Whoops, whoops, whoops. Sorry. Very good, you guys. If it's acquisition-based, we want to see an increase on a graphic display. All right. So behavioral skills training has a nice storied history. It was first coined as behavioral skills training, although there's earlier references to the procedure itself. Ray Miltenberger, professor at the University of South Florida, coined it, again, in his article in JAVA back in 1988. But you can see it's got some neat utility to it. All right. We'll review some more facts about behavioral skills training here in just a second. But its original inception was a 4-step process that you instruct. And again, this sequence is here, and it is to remain intact. In other words, the literature on behavioral skills training is so voluminous that it would make no sense for you to model first before you provide instruction, okay? So you provide instruction. We're going to learn blank, right? It's important for you to do blank, and here's how we're going to do it. Watch me, and then you literally model the skill. Once you model it, you go, okay, now you try. And you have the person rehearse it correctly. You set some type of criteria for how often they have to rehearse. No one here can tell any of us in here the exact number of times a person has to rehearse something. In the literature, you'll find it from 2 times to 10 times. And then based on correct rehearsal, you give praise. Mistakes result in correct feedback, repeating of the model, having the person rehearse, etc. Does praise always work? Of course it does not. There's no such thing as always, right? Praise often works, but there are times, especially for younger learners or learners with different types of disabilities, that you may have to incentivize them with some other type of reinforcer, okay? That's something Ray Miltenberger mentioned in his keynote address at the Florida Association for Behavior Analysis conference this year. Some people require incentives, okay? I'm gonna skip that. But a fifth component, yeah. The other thing too is Kristen made a great point. Praise is not always a reinforcer. It's not. It's often a reinforcer. But if you don't think that attention's a reinforcer for an individual, you better be trying something else, okay? All right. So here's the fifth piece, in situ or in situ assessment. I like to say in situ because it reminds me of in situation, right? So an in situ assessment is sometimes done. Just like Kristen said, that, and Aaron says that phrase is always reinforced for Kristen, 20-second hugs too, right, Aaron? Okay, so in situ assessment. In situ is borrowed from the Romans. It means in the natural, it means in the naturally occurring place. So an in situ assessment is done for those learners that don't respond to you teaching them in a clinical type setting. Most functional analysis, as you guys read the functional analysis literature, is done as an analog assessment. Analog as in analogous to, similar to the classroom setting, similar to the bathroom setting, at home, whatever the case is. In situ assessment, these guys aren't generalizing their skills beyond the clinical setting. They need taught in the environment itself. Okay, we'll talk about that more here in a few minutes. The great thing about behavioral skills training too, my friends, again, data collection is simple. It's ascending. So 0 would represent something you don't want to happen or something that negates you teaching it. And each ascending skill results in an increase in 1. So it's a rating scale score system. Very, very simple to implement, very simple to take data collection. This is a data collection system I'll make sure I make available to Kristen and Aaron to make available to you guys. I have an Excel version of it that also produces a graph, and this is one I made for Word. 0, again, will reflect the skill you don't want to occur. 1 is the first step. 2 means they do step 1 and step 2. 3 means they do step 1, step 2, and step 3. You can go up to 5 steps. I've never seen 2 steps. I've done 3 many times. I have done 4, and I've seen literature with them have done 5. You could have more steps than that. I just kept it at 5. The back of the data sheet has this, the sequence of BST. It tells the people who's ever doing it exactly what to do. Explain the sequence, model it, have the person say it correctly X number of times, give feedback, provide specific individual feedback about the individual sequence correctly. But I probably should change that to address Kristen's thing about what if praise is not feedback. Feedback is not a reinforcement. Assess in situation. 30 minutes or more after the teaching session, tell me what to do blank. Show me what to do blank. Here's the great thing about behavioral skills training. I can assess on one sheet what you say. I can assess you on behavioral skills training what you do, because they are 2 separate things. We have individuals with emotional behavior disorders who can say, yeah, I know what to do. When I'm told to line up, I walk to my square. I put my hand by my side, and I don't touch anyone. And then they go to line, and they wait for you to turn your head, and they smack their neighbor in front of them. Right? Meanwhile, you've got guys with autism sometimes who don't speak and they can't articulate anything. And when you say line up, they walk to their square, put their hands by their side, and don't touch their neighbor. Right? So you can assess both vocal report or knowledge in behavioral skills training, and you can assess skills of what a person does. Which, again, I think this also plays to the sensitivities we should have as professionals for counselors and psychologists who value talk-based ideas and value thought, if you will, or knowledge, and will help them understand what you did is valuable to them as well. I really believe that. In my heart, I come from psychology, and while I've always been a behaviorist at heart, I revere people who have better skill sets and better listening sets than I do, which are counselors, psychologists, and social workers. Okay? They are very process-oriented. They're very good at listening, and they're very interested in how people think. It's good to get a vocal report. Because people can always go, well, he practiced it with you, but he didn't know. If I'm getting the vocal report and I'm getting the skill sets assessed, I'm good. All right. So I'm going to talk about artificial agents type. I'm going to be very brief about it. Again, an artificial agent is just you using something to try to replicate stimulus conditions. It helps to develop stimulus control for low probability events, a simulated substance or object that's implicated in a safety risk. So an idea is a non-working lighter. So I was talking to Jenna Lee the other day about some talk we're going to give on self-injury, and she was talking to me about a client she had who was restrained by handcuffs, and that she had to go to an adult-themed store to find bondage handcuffs, which weren't real handcuffs that he could wear and restrained his movement by being attached to his thighs but weren't actual handcuffs, which was what he was using to be restrained in. I found stash lighters on a head shop where they sell drug paraphernalia, because I was working with kids who we're going to talk about in a minute who committed arson, and I needed to expose them to a lighter without exposing them to a lighter, because I'm not allowed to bring a lighter into a public school system. And so stash lighters have no fluid in them. It looks just like a Bic, okay? It sparks because it's metal on metal, but there's no fluid in it. There's no tube. It's called a stash lighter because it's hollowed out so people can put in marijuana, cigarettes, or pills. In any event, it's a non-working lighter. And we've done some research with individuals with hemophilia, and we used fake blood. I can't make a person bleed to teach them how to deal with bleeds. So we have to use something that's artificial. And a disarm gun is used often in the behavioral skills literature. It's a gun, it's metal, etc. But there's no firing pin, there's no ammunition. Again, it's been completely disarmed. So we try to replicate stimulus conditions, and always should, to the greatest extent possible, to foster behavior change. So skills taught using behavioral skills training: abduction prevention, discrete trial training, sexual abuse prevention, gun safety, age of individuals from 4 to 18 plus, 33 to 57, 4 to 7 years old. Intellectual functioning, this works with individuals with cognitive impairment. They just have to have some verbal abilities to benefit from the instruction. If not, why would you deliver instruction? Okay? So again, a lot of generality to this procedure. Okay? So, a few years back, when working for the public school system, because of federal education laws related to suspensions and expellable offenses committed by students who are in special education, I had to write behavior plans. And they asked me to attend a meeting for 2 boys, 10 years old, who had committed felony arson. They burned down a trailer in the trailer park they lived in. It was abandoned. Both boys blamed the other. They've been taken to juvenile detention. They were in JDC for 3 days. We think they were probably spanked by their parents and what have you. But they set fire to a trailer, burned it down, and I got the referral. Okay, so you have to go help, right? So the question I have, of course, is fire safety an issue? I think all of us would say that it is. Okay, does the behavior require additional consultation? I would argue it did. Why? Because I feel like I'm incompetent? No, quite the opposite. I feel very competent. Always feel like it's a good idea when we're talking about dangerous behaviors, severe complex behaviors, that you should consult with someone. Fortunately, I had 14 great colleagues I worked with, and I can always call on one of them to ask them for additional consultation. Okay? Most of us, when we get severe complex problem behaviors, want to go to our boundaries of competence and say, this is not an area in which I'm competent. There is no one who's competent in fire setting, because there's never been an article done on fire setting. So all behavior analysts says, teach, conduct research only within the boundaries of their competence, defined as being commensurate with education, training, and supervised experience. Okay? Does that mean after we get done talking today, all of you are experts in fire setting? Probably not. All right, but you have a starting point. You have a starting point. Behavior analysts provide services, teach, or conduct research in new areas only after first undertaking appropriate study, training, supervision, and or consultation from persons who are competent in those areas. If you have a child who sets fire, do I think you should email me? I do. Do I think you should reveal any confidential information? You should not. Do I think I can point you in good directions? I think I could. Okay, and that's, I think, how we have to think about ourselves as professionals when people consult with us, right? All right, let me get to Jessica's comment. Visuals can be placed in a verbal instruction for low function. Oh, Jessica, never thought of that. Hi, Jessica, how are you? Jessica is my good friend, baseball fan, and former colleague at the Broward County school system. But now she abandoned the South for the Great White North. All right. So, when do we consult? Consult with anything with which you're unfamiliar, right? Self-injury, you should be consulting. You might be the world's greatest expert in self-injury. I think you should be talking to someone else as well. Any behaviors that can impede on the rights of others, aggressive behavior, sexual behaviors, etc., probably require some consultation. And then novel behaviors with which you are unfamiliar. Okay? Oh, third question. Should we refer away this person to a counselor? Guess what my wife does for a living? She's a mental health counselor. She's actually a licensed mental health counselor, a certified addiction professional, and a BCABA, who's going to be studying soon for the BCBA. So, no, Katie, she's powerful. I'm just a guy who likes to talk about behavior and hang out with my family and surf a little bit. But anyway, so she is a counselor. So should we refer away? One of the questions people used to get wrong on the board test all the time referred to referring away. Do I think you should refer away to a counselor? No. Do I think you might refer to a counselor as well? Probably. Okay. More often than not, I would argue that counselors probably have more experience with kids who have set fires, and that's who the parent is first going to bring them to: a doctor, or b a mental health professional. So I think you should look to that. Yeah, I don't think you should refer away. By refer away, I mean don't take the case. Sorry, by refer away, not refer directly, not refer along with your work. You're going to also suggest counseling. Okay. All right. Groovy. Here we go. So, do I ask for consultation? Yes. But by the way, I did not ask for consultation for my wife. That would be a dual relationship. That would have been bad. All right. So, what are the conditions under which the behavior occurs? This is what I want to get into here. Let me answer this, and then Calvin, I'll get to your comment. This is the one thing I kind of want to impress upon us today. The boys set fire in an abandoned trailer in the absence of adult supervision in an afternoon away from school. But because of federal special education law, I'm required to write an FBA and address it with the BIP. If they served in special education, they show this pattern of problem behavior or commit an expellable offense. And felonies are expellable offenses. Okay? I cannot replicate those stimulus conditions. I cannot get another trailer. Can't have them practice not setting fire to it. Not setting a fire is not a behavior, right? A dead man cannot set a fire, right? So again, we have to carefully look at the examinations under which the behavior occurs, because it also tells us where our science is great and where it is not yet. We know some of the stimulus conditions, but if you think about, I'm going to talk about knives later today, kids bringing weapons to school and people having weapons on them. Most children who bring knives to school obtain the knife covertly, which according to any of us who believe in behavior analysis believes, because if I said what was the function of Andrew bringing a knife to school, 9 out of 10 times most of us would say it's attention. But to get the knife in his backpack, the knife itself going into his backpack, the behavior of putting that in backpack had to at least involve some type of automatic reinforcement, because there was no social reinforcement, at least for several minutes, if not a few hours, right? There has to be an automatic component. I think we've got to be careful sometimes about the conclusions we draw. Brandishing a knife clearly probably has an attention base to it. Do I think there was some attention-based tomfoolery going on here? Of course I did. Any of you guys talk to psychologists and counselors about children and adults who set fires? What's the first thing they say about it? Any of you? Well, yeah. They refer to it as arousing. It's automatic. There's an autonomic feeling to it. I mean, think about stealing and everything else. There's that buzz, right? So we've got to be careful that we can assume that just because there's a social condition means that's the function. And that's what I'm trying to say today. With severe complex cases, the idea, we've got to move beyond the idea of function, and that's where Hanley's going to a little bit, where we're not talking just about attention, access, escape, and automatic, right? Life is big. People engage in a behavior, produces a certain kind of consequence. What kind of consequences does it produce, right? All right. Give me just 1 second. Let me go back to Calvin's thing. I wonder about this as well. It's feel weird asking a Facebook group. Is there a trauma specialist? Just feel like the person should be active team member for the client. Calvin, lots and lots more people are getting by trauma. My wife actually is certified in trauma something as well. But yes. Now, I had some pretty fun discussions with her that that I don't see trauma the same way counselors do. Do I think going through horrible things has an impact on us? Of course I do. I don't think any of us don't believe that that's true. Do I believe it's necessarily the basis for problem behavior? I don't know that I do. All right. My friends, what do these look like? What do these look like? So they are lighters, Kimberly and Liz. What do lighters look like? That looks like a rainbow color of toy fun goodness, doesn't it? Pez dispensers, fuel, rainbow toys, markers, right? Opportunity, that's right, Carrie. It looks like something you want to put your hands on, doesn't it? They are made to look attractive, right? So, what's the problem with this? Well, we'll talk about skill deficiency in a minute. Here's going back to the problem. You've got these beautiful lighters, okay? And there is some research, not about fire setting, but about how dangerous fires are. When age is a factor in fires set by matches or lighters, 37% were started by juveniles ages 10 to 17. The 2002 estimates, 144,000 fires ignited by lighters or matches. 1,877 injuries, $470 million in property damage, and an estimated 321 people lost their lives as a result of fires set by matches or lighters. Okay? And in spite of this, some research suggests that we teach fire safety via games. This has been a damning thing for me over the last few years, is that we treat children like adults, and we treat adults like children. Okay? We expect children to color a coloring book and to have behavior change. How many of you guys took CPR? Anybody? You did? Okay, let me ask you a question. When you guys were taking CPR, okay, oh, you're a CPR instructor here. This is awesome. So, Aliano, when you were in CPR, did I do a coloring book and pass a test and you hand me a card? Wait a second. Hold on a second. I'm a master's educated 50-year-old adult who's been a professional for years. I'm well respected in my community. I think my family loves me, right? You mean to tell me that I can't just say I know what to do and you'll give me a card? You mean to say you'd actually make me demonstrate it? That you'd actually have me practice on the practice dummy and you would observe me doing it correctly and give me feedback based on my rehearsal, make corrections to the point I make a mistake, make me do it until I get it right, have me also pass a test so you know I show knowledge, vocal report, and I demonstrate it? Yeah, it's basically there's a lot of great behavioral skills training that's not thought of as behavioral skills training, but it is. You guys, why do we expect adults to come out for get a license for driving a car or for CPR, get our CPR card? How is it we expect them to both know things and demonstrate, but we don't expect the same of children? It makes absolutely no sense. Absolutely no sense that you go coloring books and happy-go-lucky games. If you want to teach a child how to do something, teach them how to do the thing you need them to do, right? All right, so we had 3 10-year-old boys. 2 of these boys we worked with had pending felony arson charges. The other boy was the secretary of the principal. She had heard about us coming into school and had a 10-year-old son and asked if he could participate, so we allowed her to do so. And we conducted all sessions in the school counselor's office, okay? So again, I'm not gonna go into detail on the data, but we took data on our behavioral skills training sequence that we wanted to do. First of all, we did a baseline, and the baseline was an in-situ assessment. We wanted to make sure that we tested it in the absence of adults, because we thought it didn't matter if they did it in front of us. It mattered if they did it when we were not present. And even though we know that they may have figured out that they were being tested and this was a school type of situation in a school counselor's office, we had to have in our mind, we had to have reassurance that they could practice and demonstrate some skills, that it gave us some idea that they could be safe. Not that the next time they're around each other, they wouldn't screw around, but that they could be safe. So we told them, go to the guidance office and draw a picture. And then we'd hide the video camera. We had a hidden video camera or a hidden observation area, and we'd see what they did. So after we collected our baseline, we provided instruction. Fires are dangerous. They can lead to burns. They need to kill people. Most fires are set by lighters or matches. If you find lighters or matches, you need to not touch it, not put your hands back, leave the room within 10 seconds, and tell an adult, okay? And we did the same. So we baited them. We put a lighter in baseline in this in-situ assessment as well as in training. We put one of those stash fake lighters, an artificial agent, in a box of markers. And we said, go draw me a picture. And so inevitably they'd come across the lighter because it was sit right there on top of the middle. And we wanted to see what they would do with it, okay? Well, you'll see the results of what they did. In the modeling part of our intervention, we would go up to the box and open it up and go, oh, there's a lighter. Walk out of the room, and they would follow us, and we'd go find the principal, teacher, whoever, and go, there's a lighter in the guidance office. Okay? They'd watch us do it. Then they had to rehearse it. They had to do it 3 consecutive times correctly. Okay? They couldn't get out of it until they did it 3 consecutive times correctly. And then we gave them praise or corrective feedback based on the rehearsal. And again, we did in situ assessment. So treatment involved a day or 2 after our training. We said, please go to the guidance office, draw a picture, do I come in and talk to you? And scores from the observation of this were the in situ scores that you'll see on the data in front of you. So this data study was published in the Journal of Applied Behavior Analysis in 2014. Okay? And here we have Alex, Matt, and Brian. Guess who are the 2 set fighters? Matt and Brian. By the way, Alex, Matt, and Brian are not the names of the 3 boys. Alex, Matt, and Brian are the names of 3 of my 4 brothers. Okay? That's not a test question. So you can see a score of 0, by the way, means that they handled the lighter. So let's take Alex. Alex was our volunteer kid. Never been in trouble before, but we placed him in a room alone with a lighter and left him in front of a box and said, go color a picture. Curiosity killed the cat and also kills kids. Sadly, sad but true. He picked it up and started flicking it. Remember, it can't produce a flame, so he just sat there flicking it. Got bored with it, put it down, and started coloring his picture. Okay? A score of 1 means he did not touch the lighter, but stayed in the room and didn't tell an adult. A score of 2 means he did not touch the lighter and left the room immediately. A score of 3 means he did not touch the lighter, left the room immediately, and informed a grown-up. Okay? So before we get into Alex and Matt's and Brian's treatment data, let's check out Matt and Brian's baseline. They had been to juvenile detention. They had been admonished by the school administration. They had been through expulsion hearings. They probably were spanked by their parents. They were in a police car, et cetera, et cetera, et cetera. Let's look at how effective those punishment procedures were. They weren't. Both Matt and Brian, who had been charged with felony arson, who had been presented to a judge before returning to school to work with us, who said, you will not touch things you're not supposed to, you will go to class on time, et cetera, et cetera, et cetera. Every time the lighter was in front of them, they handled it. Every single time. They'd sit there and they'd go like this. Every time. Whoops, they both got scores of 0s every baseline. And then when we come in the room and they throw it down or place it down and act like nothing happened. Okay? You get the picture. Behavioral skills training, all 3 boys quickly got up to the requisite scores of 3. A month after, we did again an in-situ assessment with Alex and Matt. They got scores of 3. Brian moved out of our school district so we could do a follow-up. Okay? But you can see behavioral skills training produced a pretty robust treatment effect that, again, very low levels of being able to engage in the sequence without being taught and receiving some type of reinforcement for it. After behavioral skills training, you can see, again, very, very solid scores, very quickly up to where we wanted them to be. Okay? Do I know everything about fire setting? I do not. Am I happy that we did this work? Stoked. Beyond belief, stoked that it got published, but stoked to have done it anyway, because I think they at least could show us now what to do if they came across lighters or matches. Okay? If I wanted great generalization data, I should have tried working post-treatment doing matches, or what have you. Okay? All kinds of ways this could be expanded. This study's been cited 9 times in different research articles. And there's been a few research articles on fire setting since then, fire safety since then. So Mark Harvey and I were stoked to do it. So I got to give mad kudos to him. It never would have been published if it wasn't. Questions or comments about this study? So again, no evidence base here, no prior research, a severe behavior, a potentially life-altering, threatening behavior, 2 kids who are in a whole lot of both legal trouble as well as a behavior that could potentially do massive, kill them, kill other people, harm, maim people, destroy property, right? I mean, it did destroy thousands and thousands of dollars of property. All right, good. I hope you guys liked that. Hope you enjoyed that. Not bad. But remember, the exact stimulus conditions could not be replicated given the severity of consequences to a behavior like fire setting. We were okay with doing what we did, assessing the behavior to the greatest extent possible. I think is part of our ethical mandate there. And again, this is a study that's extending the very important work of Ray Miltenberger and many others who've used behavioral skills training as an effective way to teach important safety skills. Do I think you can always use it? Of course not. But I think it's something that many of you probably know a little bit and should consider expanding your use of behavioral skills training. Absolutely. Absolutely. All right. Hey, thanks, Jen. That's kind of you to say that. All right, let's talk about safety threats in school. They exist, right? One of the things that happens in schools sometimes, of course, are weapons, right? A weapon is any dirk, knife, metallic knuckles, slingshot, billy, tear gas gun, chemical weapon or device, or other deadly weapon except a firearm or a common pocket knife, clasp knife, or blunt-bladed table knife. Okay? So again, weapons, bad, especially bad in school. Possession of discharging weapons on firearms at a school-sponsored event or on school property is prohibited. Okay? It is part of Florida law that you cannot bring knives and guns to school. I'm sure you're shocked all to learn that. Okay? 2017-18 for me was the year of the knife. In under a month, I had 3 separate children in 3 different elementary schools who brandished knives in front of their peers. In fact, this is one of those knives. Okay? By the way, just to let you know, we assessed it. And I'll show you some of the cool things we did. We used an artificial agent. I asked, can I teach them what to do around knives? The head of district security, she said, absolutely not. I said, okay, there's always 2 ways, to, 2 or 3 ways to skin a pig. So my behavior technician is real handy. He took this knife, opened the handle, took out the blade, made a blade out of resin, spray painted it with metallic silver paint, and brought me of course, what looked like the exact knife. Okay? So I had 3 students bringing knives to school. I had a lot of work ahead of me. Was the behavior issue of safety? Absolutely. Okay? How do we know that? Well, there's an estimated 8,250,914 knife-related injuries treated in U.S. Emergency rooms from 1990 to 2008, averaging 1,190 injuries per day. Pocket utility knives were associated with injury most often, followed by cooking kitchen knives. Children were more likely than adults to be injured while playing with a knife or during horseplay. This is dangerous. Does the behavior require additional consultation? I haven't written many articles on knife safety. I would argue that it does. I would also argue, though, to some extent that, again, with knife safety, consultation would first involve reading the literature. Because while, again, much like we completely based our fire safety article on the behavioral skills training safety literature for guns, we did the exact same thing in practice for knives, okay? So again, we had to look at what are the conditions under which the behavior occurs. Again, the problem is a kid gets in trouble for possession of the knife. So they brandish it or show it, but they don't even have to brandish or show it. If it's found in their backpack through a search, they'll get in trouble nevertheless. It's possession of it. And again, I guess a dead person could possess the knife. So we're trying to stop a chain of events, oftentimes for which we don't have responsibility for working, again, if we're working outside of the home. We may not have direct responsibility or oversight over what that child does in the morning. Right? So we've done preventative measures with things like clear backpacks, not allowing a child who's brought a weapon to bring a backpack to school, being subject to randomized searches is something, unfortunately, especially if kids have done it more than once, we end up putting in behavior plans. Is it violating their privacy? It is. Does it bother me when we're talking about the safety and health of all? It does not. Okay? So what are the conditions? Again, this is a complicated behavior because the simple act of brandishing, all of us would argue, it seems to be socially maintained. You get some type of social reinforcement for it. But again, it's tough to say the chain of events from the time the person puts the knife, what gets them into the idea that I'm going to bring a knife to school. And of course, when we talk to children, and I am not anti-talk-based therapies, not whatsoever, okay? Children are always going to fill in the blank or give you an answer. I'm always scared. Well, someone was bullying me, I wanted to scare them, which is one I've heard more often than not, okay? Possible, but at the same time, the knife is, of course, very, very serious. And of course, I think there are some issues, too, with skill deficiencies because the children I had who brought in the knives, some of them were, one was average intellect, general education, but in the autism spectrum. 2 of them were not, right? So possession of a knife and the conditions under which it occurs, obtaining the knife is almost always covert. Many children brandish the knife, and they often do it in a clandestine location away from an adult. Consequences, of course, are delayed, and most consequences, if they're discovered, are punitive. They do not address function nor skill development. And what we know, what we do, constitutes separate responses. Because again, a child can tell you all day long, I'm not supposed to have this at school, but they brought it anyway, right? All right, so we ask our next question. Are there skills deficiencies? I would argue there are. These were all elementary school children, 9 years old or younger. And so we began doing a fluency project. We started getting a host of things that kids could and could not bring to school. And we started doing fluency practice. Again, writing a behavior plan is a complicated endeavor. I don't think for a moment I could write a behavior plan. One of the kids' father was very, very ill, wasn't receiving a lot of attention at home. Do I think that had something to do with it? Yes, I do. But do I also think sometimes that there's an assumption of knowledge for children and even for people with disabilities, because we've gone in a real good way. Over my career, you guys, in decades working with individuals with autism, since I was 16 years old, I've seen a lot of changes. And the really good changes, this person-centered, again, humanistic approach where we really value the individual's input into their programming, that we assume, even for people who are nonverbal, that they sometimes may understand what it is we're saying. I really like that. At the same time, I'm going to flip it on its head and say the problem sometimes is we do assume everybody knows everything. The young kids know the rules. And so we decided to do for these three children, because it happened kind of all in a cluster, was not only address the knife, which we can't negotiate with the knife. The knife is against the law. It's against school rules. They will get in trouble again if they do the knife. Is to address it with the behavioral skills training, but we decided to add fluency practice to it. We decided to say, you know what, rather than assume they know what's dangerous and not, let's talk about them, what they're allowed to handle, what they might be able to handle, what they cannot handle. So for example, not handle is gun, X-Acto knife, the knives they brought in, we took pictures of them and showed them those, switchblades, whatever it was. Those are no. Maybe handle like sharp scissors. Okay, they're going to be scissors, and we're not going to tell these kids not to bring scissors. Again, these children were not charged with stabbing. Okay, they were up for suspension or expulsion because of possession of a knife on school campus. So and then we decided things like, now let me give you guys another one, water gun. Now, these are all to teach them discrimination at school. Almost every kid would say a water gun was okay to have at school. Water gun's not okay to have at school. In anything that simulates a gun or a weapon can't be used in Brevard County schools. Can't be brought to Brevard County schools. So we did fluency where we made some index cards and we do fluency on them, separating them into can use, carefully, like tape dispense with a sharp edge. Can use, can't use, can use. Can't use with caution, can use, right? So we did fluency practice. All right. So we thought there possibly was some skill deficiencies there, aside from the more obvious. And what does literature say? Nothing. Again, but the literature says a great deal about behavioral skills training and safety skills. So much so that we literally verbatim stole Ray Miltenberger's and team's idea with gun safety and applied it to lighters. And then we extended that work when we worked with our children who brought knives to school. So what we did, just to let you know, was we had these fake knives. My tech was awesome. He made the fake knife like the one you saw. He made another one that was a kid brought one of the pocket knife that opened up. He took the pocket knife, took the blade out of it, made a resin blade for that too. So we were able to really try to replicate the stimulus conditions exactly. And what we'd do is we'd say, hey, we're gonna play a game of Uno. We'll meet you in the office, or go grab a book in the counselor's office, or whatever the case. We hide it in different locales, different things, and we would put we'd put the knife there, and then we had the iPhone like in the drawer already recording, and we would record whether or not they would handle the knife. None of the three kids handled a knife after the initial reaction. Whatever punishment procedures were used seemed to quell the behavior. Nevertheless, we thought teaching fluency would also be important to making sure we knew the children knew what they could handle, what they might handle under supervision or with caution, and what they could use. Okay. Questions, comments, concerns so far? Time is pretty good. Okay. All right. The simulated blade flew with us. We had possession of it, not the child. Good question. We were talking about so we literally say to the child, now, what could you bring to school? Are you allowed to use this in school? And they weren't, again, it's a great question. One of the questions that was asked to me a year or so ago about the fire safety study. About the fire safety study. Hold on, we'll get there. About the fire safety study was, why didn't you teach kids to hand it to you? I said, well, they were charged with felony arson. Who's going to believe them, right? These kids were both kind of in trouble fairly often for much smaller things and what have you. I said to put a safety threat into a child's hand, especially when it's already demonstrated, questionable behavior related to that stimulus, doesn't make any sense, right? So so the knife was there, but they couldn't touch it. They could tell us it was there, and again, 2 of the 3 kids told us it was there. Even during baseline when we didn't intervene, they would sometimes go, "There's like a knife or something in that drawer," but they would not handle it. All right, so for you guys, design a program for me. Tell me what you think we did. In the chat, just give me what would get you a score of 0? If this is your case, what gets the kid a score of 0? If I bait the kid by putting a knife in a drawer and saying, go grab the Uno cards, which are in the same drawer. Yeah, very good. Touching the knife gets you a score of 0. So what gets you a score of 1? Yeah, very good. So picking it up or touching it gets you a score of 0. Not touching it gets you a score of 1, but you also stay in the area. Very good. Let's get you a score of 2. Not touching the knife and walking away. Yes. Leaving quickly. Right? And once you get your score of 3, very good, very good. Tells adult. Let's see if you guys think, let's see if great minds think alike. Handling was defined as picking up and holding the object for 2 or more seconds, which is scored as 0. Withdrawing hands was defined as bringing the hands up and back towards shoulder, chest. That scores you a 1. Leaving was defined as walking out of the room within 10 seconds of seeing the knife, and that scored a 2 if you do both withdrawing hands and leaving. 3 would be defined as informing an adult about the presence of the unsafe object, and that would score you as a 3. Okay. It's great info. The literature only points out things that demonstrate experimental control. How can we get access to the info absent a literature besides this? Why can't we publish things like this? Andrew, I think we can. I think if we're just a little more, having been through the publication process, two of our reviewers agreed to publish this. One said, didn't think I demonstrated tight enough experimental control. And that's probably true, but I wasn't trying to do experimental control in a public school. I was trying to do the best job I could. I went out of my way to make sure I was systematically tight. And in 18 years, this is the one study we published. So it tells you how difficult it is to do research in a public school if you're not a student or coming in from the outside. But you can do it. All right. Everybody okay so far? Questions, concerns? So I think, again, the key is keep thinking outside the box, my friends. This person, do I think these kids need counselors? A kid who thinks he's being bullied and bringing a knife to school, do I think it's beyond just the behavior analyst? Absolutely. That's why I'm so thankful to work with other behavior analysts, other school psychologists, clinical psychologists, mental health counselors, family therapists, because sometimes people need to talk to people, right? My advisor told me that first day at graduate school. Andrew, people like psychologists. They find it reinforcing to talk to others. All right. Let's talk about another severe complex behavior. Let's talk about pica. How many of you guys have worked with pica before? All right, many of you. All right. Stephanie has, my good friend Stephanie. Out in California. Hopefully sequestered, staying away from everyone and staying healthy. I hope all of you are. All right. So noted instances of pica in literature include ingesting rocks, sticks, dirt, feces, soap, paper, Legos, cigarette butts, mulch, rubber gloves, and alkaline batteries. You guys, it is never, juvenile humor is never lost with me. Never, ever lost with me. And I've always loved that in the literature on cigarette butt pica, it says butt pica per minute. And when I show that to students and they see butt pica per minute, they don't at first know that they're talking about cigarette butts, which is really, really funny if you think about it. But anyway, So awesome. Good stuff. Wow, wow, wow. Some serious pica. Some of you got personal experience with it. Malabstraction, very, very serious. Lots of questions here. So very good. So pica, not all that unusual, right? But it's a severe and it's a complex behavior, right? Is it behavior of issue of safety? Yes. I've always been amazed that when I read the literature years ago on trichotillomania, chronic hair pulling, and a lot of people with trichotillomania actually also eat their hair. If you listen to Doug Woods, I recommend reading Doug Woods. He and Ray Miltenberg have a great book on tics, trichotillomania, and repetitive behavior disorders, and a lot of research. He's on the Western Michigan series as well. People don't swallow or digest hair well. It can actually really harm you. I didn't know that. Again, hair pulling doesn't seem that innocuous, right? This seems horrible. This doesn't seem as bad, but a lot of people who do this, and that can be very harmful. So the ingestion of inedibles. Holly, I'm so with you. It's such a great book. Such a great book. I think every behavior analyst should get it when they get certified. The BCBA should just hand it to them and say, here. This helps guide your practice. All right. Is behavior a safety issue? I'd argue, and most of us argue, yeah, it can be, right? Is additional consultation required? Sure. But I'm sure that the biggest thing we think, I'll try to find one at the end, Angie. What was the first consideration we hear, Pike? When we think about behavioral consultation, medical consultation. Medical consultation, of course, is part of our professional and ethical compliance code. But this does not mean we forego behavioral assessment. And again, that's one of the things I get a little bit concerned about, given that the vast bulk of certificates have been certified in the last 5 years, and that is not a knock on any of you who've been certified in the last 5 years. What that means is I'm afraid sometimes that people's newness to the field isn't harming them as behavior analysts. I don't mean that. I mean, sometimes I think we defer too much to medicine, and it's not, and my oldest son has a very serious chronic medical condition. I have an absolute reverence for the medical profession. They're also not, shouldn't be deified. They're like us, they're practitioners, and they practice on us like we practice on other people. Because we seek out a medical consultation, sometimes people think that's grounds to not assess. Quite the opposite. You should continue with your assessment. You should continue collecting data, whatever data it is you're collecting, and continue especially collect ABC data, because you can get data that suggests whether or not you think the behavior has some type of social consequence as well, right? So please, please, for all you guys who are new and incoming, don't be intimidated when somebody says, well, that could have that behavior is automatic, or I think there's a biological etiology to it. Very well could be, but it doesn't mean you stop doing assessment. Know your process, right? Review your records. Interview central participants, begin collecting data, take ABC data, right? So we recommend seeking a medical consultation if there's any reasonable possibility that referred behavior is influenced by medical or biological variables. For our friends who shared, was there any medical things that helped your children? I've heard that there's sometimes and read that there are theories about mineral deficiencies and things of this nature in pica. I have not seen that. Most of the pica I've seen has not been, to my knowledge, it's not the result of mineral deficiency. Okay. No one's saying so I doubt that. Okay. So, should the behavior require additional consultation? Absolutely. Absolutely it should. Okay. And then we ask again, what are the conditions under behavior, which the behavior occurs? What skill deficiencies contribute to the problem? What does the literature say? Again, the conditions under which pica occurs are varied. Now, again, there's lots of literature, and some literature says that pica has often been demonstrated to be maintained by automatic reinforcement. The behavior directly produces the reinforcer. And again, I'm begging us to move towards Ennio Sapani's conceptualization of function. It's the best, not because Iwata didn't pave the most important path. He and his students and colleagues did, okay? But Sapani's got the best conceptualization of function. Behavior can directly produce a reinforcer. That's automatic or autonomic, but I can directly access my drink, right? I can also directly escape the environment. If fire starts, I can remove myself from the building. I can also directly produce some type of stimulation, vestibular stimulation by rocking back and forth. When we're talking about automatic, we're talking about a direct link between behavior and reinforcer, almost as if they're one and the same, okay? I think sometimes, and I've talked to some of my friends about this, I think we always feel that behavior has to produce something else. Behavior does produce something, but sometimes the behavior that's produced is the reinforcer, right? Then social mediation, that's the reinforcement of being provided from another person. That's access, socially mediated escape, socially mediated access to tangibles. Attention is always socially mediated. Again, things are, escape is not, it can be direct or socially mediated. Access can be direct or socially mediated. So let's think about that with respect to Pike, okay? So if you go back into the older literature on Pike, and this article is a great one, written by Piazza, Fisher, Hanley, LeBlanc, and we're talking some huge people in the field here. They did their functional analysis, assessment analysis. The session room was baited with items identified by the medical team to be safe for mouth or consumption, including Velcro strips, tape, paper, a chair cushion, and a blue plastic stick. Paper birthday candles, uncooked beans and pasta and rice sticks, a stuffed bear, cloth towel, plastic toy, and a slinky. If you read the initial articles on pica, they allowed these people sometimes to get close to putting items in their mouth or potentially swallowing them, okay? Obviously, there was probably a ton of safeguards in place. We weren't there, we don't know, but you would assume at treatment centers like Kenny Krieger, Johns Hopkins, they obviously have probably some significant medical oversight. Nevertheless, when we have to assess pica, it's incumbent on us to think a little bit differently. So when we were challenged with a 17-year-old boy this past year who was engaging in pica, we would bait him, but we decided we were not going to use anything really that he ate that was problematic. He ate the primary forms of pica for the young man we were referred to. He ate mulch, he ate paint chips, and he ate plastic plants in his home, okay? So we were asked to come assess, evaluate, and work with this kid because he was regularly, he sometimes ate staples, not as often, primarily paint. He tried to peel off the wall, pieces of the wall he would peel off, mulch, plastic plants at home. Well, again, my same behavior tech guy I was working with last year, Matthew, is just a great dude, and Matthew loved to be creative. And so we decided, I think one of the great things about being a behavior analyst with severe complex cases is much like going through, and again, guys, I've never smoked a joint, I've never had a drink, okay, in 50 years of living. I got to find out where a stash ladder was and go on all these salacious sites, but I got to be creative and explore. The coolest thing about being a behavior analyst is our ability to be creative. So what we did was, my technician for the functional analysis we decided to do, and we decided to do a functional analysis, we decided to try to kind of create mulch and a plastic plant, but we used pasta that was colored with food coloring, and we used rice that we clumped together, clumped together, and used food coloring, okay? Not bad though, right? These are, of course, things that I would assume he would think were inedible, but they were actually edible, right? So, yeah, Emily, he's a super talented guy. Great, really fun to work with. It's some cool stuff. A lot of research, again, to consult. And it says, again, let's talk about this for a minute. We did decide to do a functional analysis. There were competing ideas about why he was engaging in pica, and he didn't engage in high-rate behavior. High-rate behavior, of course, can be sometimes difficult to assess. And so in prior research, it says the alone condition may represent an efficient screening procedure when, whoops. Sorry, mouse problems. The alone condition may represent an efficient screening procedure when maintenance by automatic reinforcement is suspected. This came from a woman named Angie Querim. Angie Querim was a Iwata student who now runs a practice in Orlando. Sorry, Angie Campanelli is her name now. And Angie is a real bright woman and did her dissertation where she looked at functional analysis. Most of us know about functional analysis, but like a lot of us are interested in the ways functional analysis has evolved. Many of us with Dr. Hanley's work, but also I'm still super interested in the work of Dr. Iwata and his colleagues. And so what Dr. Campanelli found out was that if your team thinks the behavior is maintained by automatic reinforcement, rather than run through every different condition, Dr. Campanelli's research suggests that you could run the alone condition repetitively. And if your behaviors end up, again, measured in the same fashion, at a higher rate, high percentage, whatever the case is, fairly stable, then that's indicative of function, and you don't need to run every other condition. You could then conclude based on data that the behavior is automatically maintained, and you wouldn't have to go further. Everybody okay with that idea? Make sense? Okay. So not only did we decide to do that, but again, one of the things I'm trying to encourage you guys about severe complex behavior too is it's the greatest time to experiment. When you don't have every answer, and none of us have every answer, it's the best time to experiment. So not only did we decide to do Dr. Querum's screening procedure, because while there was not consensus, most of us believed that the behavior was maintained by automatic reinforcement, we also decided to do a latency-based functional analysis. Latency-based functional analysis is different from traditional functional analysis in that the dependent variable is latency to the problem behaviors. They only engage in the problem behavior once. You set your time, which is here 300 seconds or 5 minutes. We put them in a room, and again, functional analysis, the room is typically austere, not very many stimuli in the environment. It's simply a table, a chair, and then we bait them. We had the mulch, okay, on a napkin on the floor, and then the plastic plant, we had a video camera. We said, we'll be right back. You know, and we then, after 5 minutes, we'd go in, and then we'd go back and watch how quickly he engaged in eating the inedible item. Okay, so in a latency-based functional analysis, you're looking to see how fast they are to the response, not how often they're engaging in the response. So a lower level of behavior in a latency-based functional analysis is indicative of function. So you can see the first time he waited about 2 minutes to, when he was alone, to start engaging in pica. And then in under a minute, he engaged in pica. And then about 30 seconds, he engaged in pica. This low level of latency, the shorter and shorter latency to the behavior, we concluded was indicative of an automatic function, and then we were going to treat the behavior as such. Does that make sense? So part of what I like to preach to my people is, and Andrew Buchanan kind of alluded this to earlier, functional analysis doesn't have to be that complicated. Yes, I'm working with a team of people at the time, and we, could all kind of, hey, let's do the screening procedure. Let's do latency. 5 minutes, won't take a long time. This whole assessment, by the way, took about 35 minutes between the sessions, reviewing the video, charting the data, giving the guy a break from the session, coming back and doing it again. Okay? So about 35 minutes. All right? And then we need to write an individualized behavior change program. As you guys know, our ethical code does not suggest cookie cutter. It says we must tailor behavior change programs to the unique behaviors, environmental variables, assessment results, and goals of each client. I'm not trying to go off on a tangent because I have seen successful use of chewies and things of this nature. I've always had a problem that sometimes with my more impaired clients, that we try to teach them to not eat an inedible item by giving them an inedible item to put in their mouth. I have seen successful use of the chewies, and so we should never use those, okay? I want us to be conscientious that everything has to be tailored to the individual. Fair enough? You guys probably all know that. It's right now with kids bite or chew, that's the default thing is give them a chewy. And I think we should be careful about that. So we found out what his favorite things were. Again, we did a paired stimulus preference assessment, forced choice. Here's 2 things, pick which one, you record which one he picks first. You run through all the permutations several times to really see if you can figure out what is X. This guy was, by the way, completely non-vocal. He did not speak. And then not a very developed MEND repertoire, not a very developed receptive repertoire. So you could see Oreos and brownies were his 2 favorite things. So you've got the small tiny Oreos and small pieces of brownies, both which were provided by his mom, and we put them in a fanny pack. And he could access them at any time, and that was the treatment. Let's see how it worked. There's his baseline. Baseline, always the time before we introduce our intervention. There's the frequency of his behavior, a fairly stable baseline, a little bit of variability in there. But again, in around 5 times per day. So we're not talking about high-level behavior. But again, as some of our colleagues said earlier, with some of their serious cases of pica that they've dealt with, pica can present some problems. You guys, I did a presentation many years ago, one of the first Ignites I ever did at a behavior conference, these 5-minute fast-paced talks that Kristen and Aaron, some other friends do. I called it My Life as a Series of A-B Designs, because there was my life before and after marriage. There was our life before and after kids. And there was my life as a behavior analyst, where most of the time, my data sets are A/B designs because there's not a principal parent in the world, okay, that will let you take away an intervention that's working. There's very few. There's very few, right? And I think as a practitioner, you have to be okay with that, especially with cases of severe and complex behavior. And so let's look at our treatment, you guys. Giving him response-independent access, allowing him to have a fanny pack on. And fanny packs are coming back, by the way. My teenage kids wear them, okay? But giving him a fanny pack and allowing him to access food on his own resulted in a diminished occurrence of pica. This probably makes sense to all of us. If I find placing things in my mouth to be highly reinforcing, then being given edible things to place in my mouth is probably equally or at least competing, right? So was it perfect? I don't know if there's any such thing as perfect, right? But this was a step in the right direction. And it was, of course, based upon many things. One, understanding that pica, even though it sometimes appears innocuous, can be very, very dangerous to people. Number two, that we would and should consult in cases like pica because it's a complex behavior. The great thing about complex behavior, though, is we have existing functional assessment, functional analysis methodologies that can give us the exact reinforcer of what that problem behavior is, and then we can come up with intervention either based off of prior evidence, our own unique intervention, and evaluate that by taking a baseline, then trying the intervention and seeing if it works. Okay? I think all of us do. All right. So I'll open up to questions in for a few minutes here, but the fact of the matter is we are not going to be able to ever prevent all severe, and whoops, sorry, bad job. 1 second. Hold on. Let's escape this. Go to the end. Slideshow. No big technical issues outside my mouse. All right, we cannot prevent all problem behavior. It's impossible. We are going to get called on to handle cases that we may feel like we are not capable of handling. But I think as being behavior analysts, we're eminently qualified to deal with almost anything. Look, if you have a case, and I had a case where we had a young man who was 6'1", about 225, very tiny elderly mother, mildly impaired, but he was very aggressive. He was beating her up. Outside of supervision, there was nothing other to call the police we could tell her to do, which she said she wouldn't do. It's not possible every time for behavior. We can't always expect to have success, and I think that's important, especially for you newer practitioners to understand. You go down swinging, right? You go down and come up with the best plan you can. You try to make sure that the person has some skill sets and knows what to do. You try to just function in the best way that you can, but you're not going to be able to prevent all problem behavior. And unless you have a messianic complex about who we are, if you get rid of the messianic complex if we have it. We cannot assume what individuals say and do are always congruent. That's why I encourage you guys, especially if you're working with individuals who have vocal abilities. Again, we had a good suggestion about the picture schedule visuals too. In any way, shape, and form you can you assess what an individual knows and reports versus what they do, because they have to be the same, right? We need those things to line up, right? And I think the cool thing is our science continues to allow us to develop methods to make the world a happier and safer place. The currency of what we do is human suffering, right? Whether it's the kid who's not talking at the same time as peers, the child or the adult who doesn't have friends, the employee who's unhappy. The currency of what we do is human suffering. And the greatest thing about our science, it allows us to ameliorate some of that human suffering. Hell, if we do a better job in the future, really targeting tissue use and hand washing, we have the chance to prevent diseases. All of us are incredibly aware right now. It's a challenge right now for us to get people to adopt a new set of behaviors and how we socialize. But we're the people that can make it happen, right? So again, kudos to you guys for fighting the good fight. Again, I hope what I said today was valuable. I hope I gave you some hope that you can deal with things that that are thrown your way and what have you, that you just keep relying on experts and one another, your own evidence and the evidence in the literature to kind of keep you on the straight and narrow. Questions? That's very kind of you. You can ask a question. We can unmute you, and you can even ask in person. Yes, Liz, I will get the data sheet for behavioral skills training, both the Excel sheet and the Word sheet sent to Kristen and Aaron, and I will also send the PowerPoint. Keep it in your back pocket. BST is that great, it's a pocket procedure. So I'm going to go on for 1 second. Let me give you the origins about why that happened. So years ago, so you guys really technically behavior analysts are kind of breaking our ethical code. So one thing they don't teach you, I'm actually writing a book on behavior analysis in schools with 2 friends of mine. And one of the big challenges then when you are doing behavior analysis in schools, you come up with something called a manifestation determination review. A manifestation determination review means that a person with an IEP, an individual educational plan, has committed an suspendable or has moved past 9 days suspension or has committed an expellable offense. Okay, I'll give you the third question, you guys. Give me just a second. All right. So they commit an expellable or suspendable offense, and you go there and you have to write an FBA. You heard me right. You have to write an FBA. So I've never seen Stephanie in my life. I don't know what she looks like, and yet I have to write a plan on Stephanie. Okay, so we all know that every assessment write is supposed to be based on direct observation. So I'm like, well, shoot, I can't be ethical as a behavior analyst. And so every case that was presenting itself, usually suspendable, expellable offenses are higher function individuals. And so since that's the case, most of the time I'm like, well, shit, behavioral skills training fits. It's the one thing I can look at a meeting and they can go, Mr. Houvouras, what are you going to do about Stephanie's behavior? And I can put in a brief plan, I'm going to do behavioral skills training. Further assessment of the particular, another recommendation is that further assessment and direct observation of Stephanie in the school environment should take place. So we would put that in a plan, and that plan would be legal and binding and good because it had a procedure. I could figure out exactly what to teach Stephanie later. I could figure out what to ask her about what she knows later. But the fact they put behavioral skills training is an evidence-based procedure. It involves instructing. We will instruct, model, have Stephanie rehearse, give her feedback based upon her results, and do assessments in situ. Always cut it. And so it became quickly my fallback procedure. I could sit in any meeting and go, I'll do behavioral skills training. I didn't know, again, I wasn't lying to people. I didn't know how exactly I would do it, but then I could just sequence it up the way that the person needed. Yes. All right, so here's the 3 questions. Where was I born? That was Huntington, West Virginia. What sport do my kids play? They play baseball. What does my wife do? She's a mental health counselor, a counselor. She listens to people. I couldn't listen to people, so I became a behavior analyst so we could all tell people what to do. Yeah, Andrew Buchanan, a good friend of mine, Andrew, is here with us, and he has done some cool work working with individuals and does behavioral gerontology. He and some other good friends of ours. And so, yeah, tell us a little bit about BST and dementia care.
All right, let me unmute myself. Can everybody see me? I can only see you, Andrew. Okay, fantastic. Hi, everyone. First and foremost, Andrew Houvouras, way to rock it, dude. It was amazing. I learned so much about BST and what have you, but one of the things that we've been working on definitely with this COVID virus going on, and people, well, typically if you're diagnosed with dementia, you're in some type of residential living facility. Most of these things are on lockdown. Activity directors are not allowed to seek a lot of participation from it typically has to be like one-on-one. So we've been doing a lot of like, well, what I've been talking about to like the NAAP and what have you, just the activity profession. It's kind of like the ABAI of activity professionals in these certain groups. And what we've been talking about is training the trainers, right? So the med techs have to go in and all of these other people have to go in. So how can we make this fun and how can we increase the quality of life? And so what we've been really gearing towards, and there's actually some content that's going to be coming out, and I'll be glad to share that with you, Andrew, if you want to share it like blast with Florida especially. But how to train, so how to get activity directors to train people that can go in and do nice one-on-one activities to increase that quality of life with these certain things whenever they're delivering the meds and what have you. And so we are kind of gearing towards that BST model, utilizing a lot of like that, I don't know, organizational behavior management and so on and so forth. It's pretty fantastic stuff. It's unfortunate that this whole virus forced us into this area. However, it did, and so we're just trying to make lemonade out of it, I guess. But it's pretty fantastic stuff. But we've just been utilizing who has to come into contact with these people and how we can actually train, because their job is just to deliver meds, just to give baths, just to do this stuff. Well, they can do a little bit of extra stuff now, and so we've been using a lot of that BST type of model to continue those efforts during this time of need.
I love that, because but the other thing I always have loved is simple stimulus control studies. Like, we're incorporating stimulus control ideas into that. We one time did a thing where they weren't some staff, direct care staff, weren't working with individuals who were very impaired, nonverbal, wheelchair bound, and what have you. There just wasn't a lot of interactions. It just wasn't a rich environment, kind of like Andrew's describing. Some seniors dementia suffer through, and we put interaction under control of having them looking at clocks. Now, this was back before cell phones, this was a couple years back, but we put it under the presence of clocks. We put clocks all over the group home and the workshop and what have you. And we did a reversal where we took them out, and we saw the rate of interaction go down. We made it completely under stimulus control of looking at a watch, because they were often schedule based of when, like the med techs, when they go in there. So you can find that stimulus that's in every person's nursing home. When you see a bed, say this and put it under stimulus control of that thing, you get evoke the behavior every single time. Or see the person, I suppose, but you can always put it under some other stimulus that we're under. But anyway, love it, Andrew. Thanks for always sharing. Yeah, we'd love to hear more about that. Erin, Kristen, anything else?
No, but what I'm going to say is I'm putting in the chat box right now the form. I'm still going to email it out to everybody, but sometimes people just like to grab it and complete it right now instead of waiting for the email. Thank you so much for this. This was great. I don't know what everybody else thought, but my brain's tired. That's Kristen's fault.
Sorry.
Yeah, so I mean, if you can send over the PowerPoint and all of those resources, I'll wait to send out the email, and I can get that and then send that out. But everybody can grab the link. I'll put it in one more time in case people didn't see it. That's what you all need to complete within 48 hours. Send that to us. Answer the 3 questions that Andrew talked about. We'll get you your CE certificate, hopefully in a couple days. Give us some time, because we're working with Shannon too, and everything's kind of chaos right now. We also are working to put together a bunch of other CE opportunities, a couple telehealth ones, looking even beyond like autism services or providing services remotely to, I think there's one on, I don't know. There's one on parenting. There's one on the early start Denver model next week. There's another one on, I want to say like, yeah, I might have secured Evelyn Gould for an ACT, like an introduction to acceptance commitment therapy. So if any of you, we don't have a day or a time or anything, but I got a verbal confirmation that she'll do that for us. And she generally sticks to what she says she's going to do. She's awesome like that. So, yeah.
Thank you guys for doing these CEUs, especially since it's been such a really quiet time. So I want to thank you both, Aaron and Kristen. And if you could just, I guess, send out an email with the other events that are coming up, that would be great. And thank you, Andrew. It was really good.
Thank you guys. It's fun to talk to people who care about the world, and thank you to Kristen and Aaron for making this available. So it really is. It's my pleasure to do it. So you're welcome.
Well, you were, this is a great topic, and I appreciated your style. I told Aaron about halfway through, I'm like, Andrew's cracking me up with the theatrics, like when you're impersonating clients, things like that. So thank you. A 2-hour CEU event can get exhausting for everybody, but you kept it lively. So this is great.
I put in the chat our website link, so bh3inc.com/learning. That we have are constantly updating that. with CE events that we're putting together once we get confirmation and those on the schedule. If I've got it confirmed, it'll be on there. It might not have a registration link if we don't have days, times, but just trying to keep everything up to date. So keep track of that. That's probably the best way to keep, because information goes everywhere on Facebook or people don't get it. And so do that, just keep track of that website and keep checking. So thank you all again. We hope to see you in some of the future ones that we'll have over the next couple weeks. So thank you.
Yep. Thanks so much, Andrew.
Thank you guys. I appreciate you.
Appreciate you.
Thank you, everyone. Stay safe and healthy.
Bye, everybody. Have a good night.
You stop the recording.